Good morning, everyone. Ma'am, shall I start?
Yeah, yes.
The topic of my presentation is topical low-dose heparin in Stevens-Johnson syndrome and its molecular correlations. This work has been recently published in Ocular Surface, so I'll be presenting the results. Stevens-Johnson syndrome ocular sequelae is a rare yet potentially life-threatening adverse reaction caused by characterized by mucocutaneous involvement and severe ocular complication. Detailed ophthalmic consultation is warranted in all stages of SJS, including the inflammatory acute stage as well as the cicatricial chronic SJS. Previous study had reported increased inflammatory markers like MMP9 in cases, correlating with poor surgical markers in these cases. A literature also reports the presence of an abnormal cytokine storm present in the ocular surface of these patients. Neutrophil extracellular traps, that's the key focus of the study. Activated neutrophils release extracellular chromatin webs composed of DNA, histones, and granular proteins, together known as NETs. These NETs have been reported to be present in the ocular surface and in tears of various ocular disorders like Sjogren syndrome, chronic OGVHT, and OCP. Due to the increased tear hyperosmolarity seen in these cases, this leads to the activation of neutrophils undergoing a process of degranulation called netosis and release their extracellular chromatin material. In Stevens-Johnson syndrome, systemically, drug-specific T cells have released in the acute onset systemically are capable of releasing cytokines and interferons which can activate eosinophils, basophils, and neutrophils. Low-dose heparin is the highest negatively charged glycosaminoglycan with proven histone binding capabilities. We have chosen this molecule for the very this reason. It has high negative charge and it can easily bind to NETs, which is a very positively charged entity. Previous studies by Jain et al. At US have reported that sub-anticoagulant doses of heparin used topically can dismantle NET in cases of ocular GVHD eyes. Low-dose heparin also shows no ocular toxicity, hence it's a safe option. We hypothesized that LDH adjuvant therapy might be effective in reducing NET complex associated ocular exacerbation in subchronic and chronic SJS cases. This is a parallel group prospective randomized controlled trial molecular pilot study. All clinically diagnosed cases of SJS 10 were cases included in the study as per the inclusion and exclusion criteria. Subchronic cases were categorized as time to onset, time to presentation as 2 to 6 months post onset, and chronic cases at more than 6 months from onset. The workflow of this study is as follows. We screened 84 patients in our OPD, out of which 12 were screen failures, and these cases were categorized as subchronic and chronic cases, which were again randomized into two groups based on blinding method, and we gave 100 UIML of LDH plus conservative treatment, and the other group received alone the conservative treatment alone. This was done for 30 days, and we did not observe any loss to follow-up during this period, and analysis was done accordingly. Clinical investigations done were BCVA, Schirmer's test, TBUT, fluorescent grading, Lissamin staring score, ocular surface severity scoring as per the picture given, clinical slit lamp photography, and OSDI indexes. Molecular methodology includes tear sample were collected for NET ELISA experiment, as well as conjunctival imprint based RNA extraction based RT profiler array was done in all cases for TLR9, MYD88, interleukin 8, C3A, and TNFSF14. These are all NET associated genes. Results, both the groups had comparative mean age, and the causative ages were primarily antipyretics. Mean time to presentations was less than 6 months in the subchronic, and it was 49 to 51 months in the chronic stage. When the baseline parameters were compared, the subchronic group had significantly more of Lissamin staining score, while the chronic group had significantly more of loss of POV score, corneal neovascularization, corneal keratinization, opacification, and punctal involvement. This is a representative image of pre and post treatment in the heparin as well as conservative group in the subchronic stages, images showing regular fluorescein and Lissamin staining. When the pre and post clinical and ocular surface parameters were compared in the subchronic category of both LDH and conventional treatment group, we found significantly more improvement in Schirmer's test, TBUT, loss of vascularization, conjunctival epithelial SPK, corneal keratinization scores in the subchronic group. Also in mucocutaneous junction, punctal, conjunctival hyperemia, and overall severity score. While in the subchronic stage, in the conventional group, we saw worsening of loss of POV score as well as total severity score. When the improvement in both the groups were compared, we found significantly better improvement markers in subchronic LDH treated group than the conventional group. This is a representative image of chronic group SDS pre and pro treatment in both LDH and conventional group. Upon comparison, we found significant more improvement in the LDH treated group for Schirmer's corneal characterization score and conjunctival hyperemia, as well as only worsening was seen in the chronic group. Improvement wise, all these respective markers showed improvement in the subchronic LDH group. Improvement in the LDH group in both the categories shows that better improvement was seen for these markers in the subchronic category than the chronic group. Comparing pediatric versus non-pediatric cases, we found that more than adult cases showed more improvement in the...
Renu, your time is up, so please conclude.
Okay. We found that NETs were present on the ocular surface and the respective gene markers were significantly downrated post LDH treatment, and LDH adjuvant therapy showed significant improvement in stabilizing ocular surface cellular stability in subchronic cases more than chronic cases. Thank you.
Thank you. And you said this is a previously published paper.
Just now published. So.
Okay, thank you.